This video is the continuation of common ankle and foot injuries, in which we are going to discuss about plantar fasciitis and heel spur. These two conditions often coexist, so we will discuss them collectively. So let's get started. Plantar fasciitis is inflammation of the band of tissues in the foot that supports your arch and connects to your heel. On the other hand, a heel spur is a calcium deposit causing a bony protrusion on the underside of the heel bone. On an X-ray, a heel spur can extend forward as much as a half inch. Without significant X-ray evidence, the condition is sometimes known as heel spur syndrome, jogger's heel, or plantar fasciitis. Now, moving towards their symptoms. Most common symptom of plantar fasciitis and heel spur is pain. In plantar fasciitis, a stabbing sensation of pain is felt at the bottom of foot near your heel that becomes worse in the morning when you take your first few steps and may subside as you continue to walk. It may flare up after long periods of standing or when you get up after sitting for a while. On the other hand, heel spur is associated with intermittent or chronic pain that worsens with walking or running. The pain of heel spur is as a knife or sticking pin. Risk factors associated with these conditions. It is not always clear that what causes plantar fasciitis. However, there are some factors which are thought to increase the likelihood of developing these conditions, including high impact sports, a job that requires a lot of walking or standing on hard surfaces, tight calf muscles, high arches or flat feet, obesity, poor fitting footwear, aging. Increasing age with decreases plantar fasciitis flexibility and thins the heel protective fat pad. Now, the management. Pain with plantar fasciitis and heel spur may not always respond well to rest and icing, so a multidimensional treatment protocol can be used, including stretching exercises, extracorporeal shock wave therapy, cortisone injections, shoe inserts or orthotic devices, night splints, and the surgical treatment. Stretching is the most effective way to relieve the pain associated with this condition, including toe stretches. Sit in a chair and pull your big toe towards your ankle. Hold for 30 to 45 seconds. Repeat 2 to 4 times a day. Calf stretches, that is, moving the ankle in dorsiflexion, holding for 10 to 15 seconds and repeat for 10 times. This could be performed in standing, lying supine, and sitting position. Towel and band stretches. Sitting on the floor with your legs flat on the ground, wrap a towel around the ball of your foot, then pull gently around 30 seconds. Repeat 2 to 4 times daily. Now, arch stretches. Place a rubber roller under your foot and roll forward and back for several minutes. Repeat a few times throughout the day. Now, the extracorporeal shock wave therapy. This procedure uses shock waves to stimulate healing in the plantar fascia tissue. The shock waves work by increasing the blood flow to the injured area and speeding up the healing process. Now, the surgical treatment. The most common surgical procedures include plantar fascia release and the removal of the spur.